I'm Dr. Brian Jakes, Jr. I am practicing at Doctor's Studio in Boca Raton, Florida. By the time most patients get to me, they have seen multiple physicians, including specialists, and have not had results. Usually hormone problems, fatigue, metabolic problems encompassing blood pressure, diabetes, cholesterol, even things like depression, insomnia, decreased libido. There are conditions that are not being addressed appropriately because they have other roots of causes. You can't expect to have successful treatment in these areas unless you at least establish proper metabolic care. Those issues have to be addressed. That's what makes it a more comprehensive treatment plan. Other conditions such as autoimmune, that's greatly overlooked. Patients will complain to their primary care or many specialists that they have aches and pains and fatigues, and they're often dismissed as, simple arthritis, and by the time it is typically caught, it's such an advanced stage, it could develop into lupus, Sjogren's, and much more serious to treat when it has had the opportunity to progress for many years. Intervening in an early stage completely changes the outcome of these diseases. One of the biggest failures in testing is interpretation, and that makes a world of difference in determining how and when a patient is treated. And even though there are ranges in optimal markers for tests, they have to be interpreted properly. And so many times I've seen it where patients come in with prior labs from other physicians, and they have a test that would be helpful in determining what's wrong with them, but they see a number, and because it doesn't flag as high or low, and hey, you're the patient, you're okay. And that other tenth of a point can be a month or two away from changing a negative to a positive. And that's when the time for intervention is before these changes happen, to intervene in the early stages and prevent these diseases, or absolutely slow their progression. I think that a lot of the problem in care today is that if there is not a drug to treat a condition, it goes ignored. One condition is hyperinsulinemia, overproduction of insulin, and which can lead, is not necessarily hypoglycemia or diabetes, but it is a precursor to these conditions. And because there's not a prescription they can write, it's just overlooked, and the metabolic processes involved in all this continue to happen. And then finally, after years, the patient will emerge with diabetes, and it's acted like a surprise. But all the information has been there years before. We can see this all happening when you look into it deep enough and understand what's taking place. I'm very excited to be working with Dr. Roy. It's great to have a colleague that believes in the same approaches to disease care and prevention. If you'd like to schedule an appointment with me, I can reach at drstudios.com, and I look forward to meeting you.